Thank you. Hello, everybody. We're dental hygiene students from a school in Mississauga, and we're just going to do a little presentation for you about assisted oral care aids. So it's just to help with cleaning your dentures or any other stuff that you might have going on in your mouth. So my name is Acadeymy. This is Maria. This is Nikita. That's Kelly, Gurleen, and Anuri. Okay. So first we're going to talk about the importance of oral care, the challenges. Oh, you can't see? Put it down right here. Okay, so we'll talk about how oral care is important and the challenges and the different type of devices that you can use to clean. And then tips on choosing what's right for you and what kind of, if you have dentures or whatever. And then encourage you to use it on your own. Maintaining that oral hygiene is really important, and then where to buy them. So why is oral hygiene important? So we're going to talk about the common oral health issues that we usually face, connection between oral health and your overall health. So whatever goes on in your mouth is also connected to the rest of your body. So we tend to forget that our mouth is also connected to our body, and we sometimes don't brush as often, but that is also very important. And then, so good oral health supports your well-being, eating habits, speaking, and then also confidence. Because sometimes if we don't brush our teeth, we experience bad breath, which can also affect our confidence. Okay. So why is oral care important? It's preventing oral issues, so gum disease. So gum disease is when your gums are bleeding when you're brushing, right? So that's not normal, so we want to prevent that. Tooth decay, meaning cavities. So sometimes our teeth are black, eaten by sugars. So that's that. Dry mouth. So when you take medication, you can experience a lot of dry mouth. So you might find yourself drinking more water or not drinking water, which can also affect your teeth and your mouth, okay? And then also infections, okay? So improving the oral quality of your health. So when we do have these oral health issues, it can cause pain and discomfort in our life. So that's also really important that we take care of that. And then connection to systemic conditions. So those who have diabetes, those who have heart problems, cardiovascular issues, it is really important that we take care of our oral health because all of that is connected to your condition as well, okay? And then denture care. So it is important that we're cleaning our dentures because it can, bless you, it can lead to a lot of other issues. So if we're not cleaning them, it can lead to fungus in your mouth. It can lead to infection and sore areas, okay? Okay, common oral conditions, gingivitis, so that's gum disease. So when you're brushing and you're experiencing blood, that's gingivitis, okay? And then there's periodontal disease. So when you have gingivitis and you don't take care of your teeth, you can get bone disease in your mouth. So when you get bone disease in your mouth, it will start to eat away at your bone, and your bone is holding your tooth in place, right? So if that bone is starting to be lost, your teeth will fall out of your mouth, right? So we don't want to get to that point where we start to have bone loss in our entire mouth. That's why most people end up getting dentures because their bones aren't healthy, their teeth are gonna fall out, so they end up taking them out. So we want to prevent that. And then tooth decay, like I said, diet is very important. So whatever we're eating, making sure that we're brushing so we don't get cavities, okay? And then xerostomia, dry mouth. So again, that's related to your medications. Okay, as I talked about the heart disease, so bacteria from your gums can actually enter your bloodstream. And that can go to your heart and increase your chances of having a heart attack or a stroke. So again, very important that we're brushing our teeth. And then when it comes to diabetes, it's hard to control your blood sugar level if you're not also cleaning your teeth, okay? And then that can also worsen infections and lead to any kind of, suppose you hurt yourself in your mouth and you have diabetes, it won't heal as fast as it would if you didn't have diabetes, right? So it's again, making sure that we take care of our oral health. So denture care, it's important that we're cleaning our dentures. Hello? It's important that we're cleaning our dentures because there's buildup of food on our dentures too. Even though they're not our real teeth, it is important that we still clean them because we're still putting them in our mouth. Okay? And then again, sores, so stuff can get stuck underneath your dentures and also cause pain in your mouth. And then if we're not cleaning it, it can lead to fungal infections in your mouth, and that causes yeast to grow in your mouth, which can also cause a lot of other issues, okay? Okay, and then now we're gonna talk about challenges seniors face with oral hygiene.
Hello, hi everyone, my name is Maria, and I'll be talking to you about the challenges that elderly can go through when it comes to oral care. And I just want to let you know that don't worry, somebody's gonna be translating in Hindi, Punjabi, Hindi, Urdu, anything you want. We have here girls that speak that language. So if you have any questions, please feel free to ask at the end, okay? So first, as we get older, some of us will start having physical problems when it comes to our health, sometimes mental problems. These problems can affect our oral care, especially how we take care of our teeth at home. And some of these challenges can be decreased dexterity. Basically, for example, when you have arthritis. Arthritis is when you won't be able to close your fingers or hand properly. Hence, basically, you won't be able to use the floss properly or the brush properly. You can't hold it good, right? And then brush at home. Second, we have cognitive problems, basically when you have dementia or Alzheimer's, that can affect our oral hygiene. Why? Because sometimes you can forget to brush or floss, or you just forget how to use the floss or the brush, or you even forget how to do that at nighttime, morning time, all that routine. Or you can as well feel anxious about using them. Third, we have vision impairment as well. This is one of the challenges because you can miss some areas, or as you're brushing, as you're flossing, you're not doing a good job getting all those areas clean properly. And third, we're going to talk about the types of assistive devices. We have Gertie.
Okay, so मैं हिंदी में बात करने की कोशिश करूँगी, पर हिंदी इतनी अच्छी नहीं है. So हम शुरू करेंगे टूथब्रश एड्स के, और फिर उसके बाद फ्लॉसिंग एड्स और डेंचर केयर डिवाइसेस, और फिर ओरल मॉइस्चराइजिंग प्रोडक्ट्स. मेरे पास सबके लिए एक सवाल है, कौन यहाँ दांतों में थ्रेड फेरता है? हाथ खड़ा कर सकते हैं.
नहीं, वैसे फ्लॉस करते
हैं. फ्लॉस हाँ नहीं, फ्लॉस को मैंने थ्रेड बोल दिया. ठीक है, ओके. सो मैं अब टूथब्रश एड्स के साथ शुरू करूँगी. ओके, सो ओरल हाइजीन को सिंपल करने के लिए टूथब्रश एड्स होते हैं. एक तो इलेक्ट्रिक टूथब्रश होता है, उसका जो हैंडल होता है वो एर्गोनॉमिक हैंडल के साथ मिलता है, जो एक टेक्सचर्ड ग्रिप होता है. वो हमारे लिए एक एक्सलेंट ऑप्शन होता है, क्योंकि जिनके लिए वो मोबिलिटी इश्यूज होती है, रेगुलर टूथब्रश को पकड़ नहीं पाते, और वो इलेक्ट्रिक टूथब्रश जो एर्गोनॉमिक हैंडल होता है उसको यूज कर सकते हैं. एंड जो in my English is better? Okay. So the electric toothbrush design ensures it does most of the work for you, reducing strains on your hand. Toothbrush holders and grip aids are other options which can further enhance ease of use. So for additional support, toothbrush handles can be customized with a tennis ball or a towel, which offers a larger, easier to hold surface. Seated brushing is also recommended for increased stability and comfort. And to encourage thorough brushing for 2 minutes, consider playing 2 minutes of your favorite song to help focus on brushing. Okay, so flossing aids. So with the right tools and interdental cleaning, it becomes easier and comfortable and more effective to support long-term health. The 3 flossing aids I'll be covering are floss holders, water flossers or oral irrigators, and interdental brushes. So floss holders are designed to make flossing easier and more accessible. They hold the floss securely, allowing for better reach and control. especially for individuals with limited hand mobility. The floss is threaded around the floss holder, and the floss head holder is reusable. Next is the water flossers or oral irrigators. These use a targeted stream of water to stimulate the gums and remove plaque around your teeth and the gum line. They are available in a corded or cordless option. Like other flossing aids, interdental brushes are small, specially designed brushes that clean between the teeth where a regular toothbrush cannot reach. They stimulate gum tissue and effectively remove plaque that are available, and they're available in a variety of sizes, and you can select it based on your individual spacings and dental needs. These flossing tools can make daily oral care easier and more comfortable and help keep your smile healthy.
Hello everyone. Now I'm going to explain a little bit more about how to clean the denture or take care of the denture. The dentures are very important, not only for eating, but also for speech or to maintain the facial structure. So that's why when you wear denture, you can see your face a little bit youthful because of that. So we have to take care of the denture. For example, there are so many ways and so many products to use, like manual cleaning. There are special brushes and a special paste or foam or gel to clean the denture. So don't use the regular toothpaste or the regular toothbrush because they're gonna create abrasion on your denture, and also they will break it down. So also, for example, if you still are using a manual cleaning, place a towel on the sink when you are cleaning it. It's because if they fail, they don't break because it's already on the towel. Another is the dental cleansers. That is, there are effervescent tablets that create oxygen bubbles. That with these oxygen bubbles, they clean the dentures, and also they disrupt the dental plaque or the detergent and doing the cleaning action, and also that have the antimicrobial activity. And the best of the dentures cleaning are the ultrasonic dental cleaners that are effective cleaning the contaminants. They create also oxygen bubbles, but they also have jets of waves that when you put the dentures in there, they clean it so well that eliminate the microbials or everything that has it in there. When we are a little bit older or taking the medications or another factors, they create that our saliva disminute. That's why we experience that is called dry mouth. So we have so many products to help with this dry mouth. There are irregular products like, for example, the spray that is on the go. Use it every day, everywhere. When you feel that your mouth is clean, just do it as spray on your mouth. But also we have the mouth gel. That product is mainly for the night. Just put it a little, like a pea size on the tongue, and spray with the tongue on your mouth, and it will help with the dry mouth and will decrease the probability of have caries or decays in your mouth, your teeth. Also, we have the dry mouth oral rinse or mouthwash and toothpaste that are especially for the dry mouth. So that's why instead of use the regular Colgate or the regular Listerine, use the ones that are for the dry mouth, that it will be better for you, and also they clean very well. Another general recommendation for dry mouth is, for example, limit your caffeine intake, avoid mouthwashes that contain alcohol, stop or decrease using the tobacco, stay hydrated all the time, breathe through your nose, not from your mouth, and use a room humidifier at night. And also visit your dental or dental hygienist regular at least twice a year.
So now we're just going to watch a little video demonstrating.
थ्रेड वाली फ्लॉस करना समटाइम डिफिकल्ट फील करते हैं, आप बोलते हैं कि कैसे यूज करना है, सम पीपल फील लेजी, सो दिस इज अ वेरी गुड वे so that you can floss your teeth. So in this video you saw that how we can use that, right? And we'll see the next video. Convenient to use, right? It has all, you just need to press the button and then you can use it in a shower also, because sometimes हमें टाइम लगता है सीखने के लिए, बट ये दांतों के बीच में जब वो पानी आता है प्रेशर से, तो हमारे दांतों के अंदर जो भी खाना वगैरह जो भी फंसा होता है वो बहुत अच्छी तरह से क्लीन करता है, जो भी हम रेगुलर फ्लॉस में कई बार हमें डिफिकल्टी होती है। सो आप देख सकते हैं कैसे आपने सिंक से इसको जैसे स्टार्ट करना है, तो ऐसे आपको साइड में अपने हर एक दांतों की तरफ लेकर जाना है, तो फिर ये इससे आपका जो एक्सेस जो आपकी डेब्रीज हैं, फूड आपका जो फंसा हुआ है दांतों के बीच में, वो बहुत ही अच्छी तरह से साफ होता है। सो ये बहुत इंपॉर्टेंट है, क्यों? क्योंकि ये हमारे गम्स के लिए बहुत इंपॉर्टेंट है। अगर खाना हमारे दांतों के बीच में फंसा रहेगा तो उससे हम धीरे धीरे वो इन्फेक्शन होती है और फिर जब कहते हैं कि कैविटीज लग जाती हैं, राइट? सो इसीलिए फ्लॉसिंग बहुत ज्यादा इंपॉर्टेंट है, और दैट्स कॉल्ड वाटर फ्लॉसर। ओके, सो अब हम बात करेंगे टिप्स फॉर चूजिंग द राइट डेंटल प्रोडक्ट, बिकॉज हमें ध्यान में रखना पड़ेगा सबसे पहले कि कौन से डेंटल प्रोडक्ट हमें चूज करने चाहिए, राइट? सो कौन से जो टिप्स हैं हमारे माइंड में सबसे पहले आते हैं। सो सबसे पहले वो बहुत कंफर्टेबल होनी चाहिए और इजी टू यूज होनी चाहिए, बिकॉज some people don't like the new technology, और कि क्या है, जैसे वो easy to use होने चाहिए ताकि आप easily use कर सके। Secondly, cost and availability, इस चीज को भी हम ध्यान में रखते हैं कि उसकी cost क्या है और वो easily available है मार्केट में या नहीं। Third one is personal preference, कुछ लोगों को इलेक्ट्रिक टूथब्रश पसंद है, कुछ बोलते हैं कि नहीं मुझे मैनुअल ही पसंद है, अपनी पर्सनल प्रेफरेंस भी होती है। और समटाइम्स हमें कुछ रिकमेंडेशंस भी लेने चाहिए अपने डेंटिस्ट से, डेंटल हाइजीनिस्ट से, जो हमें बेटर गाइड कर सकते हैं। थर्ड वन इज ऑलवेज आप क्वेश्चन पूछ सकते हैं अपने केयर गिवर से या डेंटिस्ट से, डेंटल हाइजीनिस्ट से कैसे यूज करना है, ठीक है? नेक्स्ट प्लीज। ओके, सो फर्स्ट एज आई सेड, फर्स्ट वन इज कंफर्ट एंड इजी टू यूज। फॉर एग्जाम्पल, जैसे जो हैंडल होते हैं वो कई बार हमारे, जैसे उन्होंने मेंशन किया, आर्थराइटिस है, हड्डियों की प्रॉब्लम होती है, हम नहीं ज्यादा हैवी चीजें पकड़ सकते। इट शुड बी लाइट वेट, जो हमारा जो प्रोडक्ट होना चाहिए, ब्रश है कोई भी, वो लाइट वेट होना चाहिए ताकि हमारा कंट्रोल हो उस चीज पर। जब हम अपना ब्रश करें तो वो इजी ग्रिप बने और हम अच्छी तरह से सभी सर्फेसेस को साफ कर सकें, अंदर से भी बाहर से भी थरोली इनका क्लीन कर सकें, ठीक है? सेकेंड इज कॉस्ट एंड अवेलेबिलिटी। सो हमें इट इज वेरी इंपॉर्टेंट कि कई लोगों को अफोर्डेबल प्राइस भी देखना होता है। जरूरी नहीं है कि कुछ जो एक्सपेंसिव चीजें होती हैं वही बेटर होती हैं। अफोर्डेबल रेंज में भी और इजी टू फाइंड हम अच्छे प्रोडक्ट ले सकते हैं। कई लोगों को आप में से जैसे ऑनलाइन शॉपिंग करने का पसंद होता है, कई को जाकर खुद बाय करना है शॉपर से, वॉलमार्ट से, राइट? अगर आप ऑनलाइन करते हैं समटाइम हमें डिस्काउंट भी मिलता है, सो यू कैन गो दैट एंड ऑलवेज आप you can ask the samples, go for that. So the third one is customization options. जैसे कि आपको बताया कि जैसे कुछ प्रोडक्ट्स ऐसे आते हैं जिसमें आपको इंटरचेंजेबल टिप्स होती हैं, जैसे मैं एग्जांपल लेती हूँ इलेक्ट्रिक टूथब्रश की। सो इलेक्ट्रिक टूथब्रश में वो ऑलवेज एक्स्ट्रा हमें टिप देते हैं इंटरचेंजेबल, जैसे आफ्टर 2 months और मैक्सिमम 3 months के बाद आपको फील होता है कि जो ब्रिसल्स हैं बहुत हार्ड हो चुके हैं, अब हमें चेंज करना है, तो हम वो चेंज भी कर सकते हैं और ये हमारे लिए अच्छे भी होते हैं। सो प्रोफेशनल डिवाइस एंड प्रोडक्ट अप्रूवल। सो जैसे कि आपको बताया कि जब आप अपने रेगुलर डेंटिस्ट के पास जाते हैं, डेंटल हाइजीनिस्ट के पास जाते हैं रेगुलर क्लीनिंग के लिए, वो आपको हमेशा गाइड करते हैं। क्यों? क्योंकि उनको पता है कि उन्होंने आपका ओरल देखा है, अंदर ओरल कैविटी आपके मसूड़ों के हिसाब से वो आपको रिकमेंड करते हैं एक्चुअल सही प्रोडक्ट जो आपके लिए इम्पोर्टेंट है और आपके लिए जरूरी है। सो दैट्स वाई वो आपको उनकी रिकमेंडेशंस को भी मद्देनजर रखना चाहिए। सेकेंड वन इज कि ऑलवेज वो रिकमेंड करते हैं कि जो प्रोडक्ट आप यूज कर रहे हैं वो CDA और अमेरिकन डेंटल एसोसिएशन और कनेडियन डेंटल एसोसिएशन की तरफ से एक्सेप्टेंस हो, लाइक उसमें सील ऑफ एक्सेप्टेंस हो। एंड द लास्ट बट नॉट द लीस्ट मेडिकल कंडीशन एंड मेडिकेशन, जैसे कि उन्होंने एक्सप्लेन किया, हम जैसे कुछ पीपल जैसे वो मेडिसिन खाते हैं, काफ़ी मेडिसिन हम खाते हैं, उसकी वजह से हमें सबसे पहले जो प्रॉब्लम होती है वो होती है ड्राई माउथ की। मुंह सारा दिन हमें ऐसा लगता है कि पानी बार बार सिर्फ सिर्फ वो वाटर पीते हैं, तो इसको भी हमें ध्यान में रखना चाहिए, क्योंकि अगर हम कुछ ऐसे प्रोडक्ट यूज करेंगे जिसमें अल्कोहल के लेवल, जैसे कुछ माउथ रिंसेस हैं उसमें अल्कोहल लेवल ज़्यादा होता है, तो फिर वो ड्राई माउथ ज़्यादा होता है। तो इसीलिए हमें इस चीज़ को भी ध्यान रखना है कि कोई भी प्रोडक्ट हमें खरीदना है वो हमारी मेडिकल कंडीशंस को भी मद्देनजर रखें, जो आपको बताएं कि कौन सा आपको यूज करना चाहिए, ताकि मेडिकेशन और प्रोडक्ट का आपस में कोई प्रॉब्लम आपको ना आए। सो आगे वो डिस्कस करेंगे कि केयर गिवर्स का क्या रोल है।
Hi again, it's me, Maria. Okay, so I'll be talking to you about the caregiver roles when it comes to oral hygiene and helping your elderly friend or family member. So first you can provide gentle assistance. For example, you can use the hand over hand technique as your elderly family member doing their brushing and flossing. You can put your hand on top of theirs and do the brushing for them. If they can't get up to the washroom, you can help them by doing the brushing for them as they're laying down in their bed. And you can help them, for example, by putting a cloth under their face, so if they need to spit, they can spit out on the cloth. You can help setting reminders to do their cleaning. Hey, did you brush today? Did you floss today? Do you need help with that, right? You can help them by doing the appointments for them, booking the appointments for them, calling the dental office and booking that appointment for your friend. And yeah, maybe playing some of their favorite music in the background to ease their anxiety. Yeah, there's so many things that a caregiver can help with. Now we're going to be talking about maintaining motivation.
Hello, so I'm going to be talking about maintaining motivation. So it's important to set goals for yourself because they help you be focused, have motivation, track your progress, and prioritize any tasks you have. When you set your goals, you should make sure they're specific. First, identify what you want, like what's the goal you want to reach. So it'll be like, I want healthy teeth and gums. So that's like what you want to achieve. So set your goal based on that. And when you set the goal, it should be a SMART goal. So it should be specific, measurable, attainable, relevant, and time-bound. So like a goal you can set for yourself is, for the next month, I'm going to be brushing my teeth once a day, and make sure that I track it on my tracker for at least 5 to 7 times in the week that I have flossed. So that's my goal. And then once you have your goals ready, you should create an action plan as to how I'm going to achieve those goals. And when you do your action plan and you implement it, make sure as you achieve your goals, you reward yourself or you celebrate your goals that you've reached. So I have flossed. So I flossed once a day for the next month. I'm going to reward myself with something I wanted that week. So the way you can track your progress is, you can have daily reminders. There's an app on your phone that you can set, and you can just put in a reminder on the phone. And when you have the reminder in, it can remind you maybe a week in advance or like a couple of days in advance if you have a dental appointment. So you can have that as an online version, like on your phone. Or if you're someone who likes physical things, you can get a physical tracker, and there's specific trackers made for like dental oral health. So it shows that, yes, you should be flossing these many times per week, and then you can just record it onto your tracker. And if you can't find a tracker, you can always use a journal. So you can just write down that I will be flossing these many days, and I have flossed. And having a journal, you can reflect upon what you've done, and then just any challenges or complications you faced or anything you need to change. So that's how you should track your progress. And next is resources and where to buy them.
Okay, so now that we talked about all these products, I'm just gonna let you guys know where you can buy these. So like Nikita said, if you like online shopping, there's always Amazon. You can get your family members to buy those for you, your grandson, your grandchild. I'm sure they know how to work the phone very well. So Amazon's a really good option. Walmart, Shoppers Drug Mart, when we go for our groceries, there always is an aisle where there's our toothpaste aisle, where we see all the brushes. All your resources would be there. And yeah, so we can also, like home delivery is very easy, but again, if you're going out for your groceries, Walmart and Shoppers are always your best bets. Okay, and that's all. Hope you enjoyed our presentation. Thank you so much. If you have any questions, please ask. Yes?
I have gone and gone. I have collected so many. So most of the medium and the soft are too hard for me.
Soft
so
is
I like very soft, but sensitive, rarely available. Shoppers and every shop. The second one that I have collected so many. They are such good quality. The other dental students, they gave us some samples. They were such good quality. I keep up
Sorry,
pictures.
what was that quality?
They break so easily.
Give to them. Ask the questions. You have to give to
Yeah, pick up the little, pick up,
I took a picture of what they gave them.
Okay, I'll re-explain what her question is. She's saying that when she goes to Shoppers, she tries to look for dental products like her toothbrush. She likes extra soft. So soft and medium is too hard for her gums. It hurts her gums. And she likes these interdental brushes. So they kind of look like toothpick, but it has a brush on the end that you can put between your gums. So to answer your question, online. So online would be your best option. A lot of the stuff is not in Shoppers. There are some extra soft toothbrushes, maybe they're always sold out, but if you have specific concerns and specific needs, online shopping would be your best, but even better is going to your dentist. So if you go see your dentist or your dental hygienist, they will listen to your needs, right? And they always have samples to provide them, but I understand what you mean, like you want to buy them yourself. So honestly, online would be your best option. If you have any family members that can help you with that, no, I know. So again,
drive and go by outside.
Please stand up and then
I hope you can find it, but I think online is your best option, okay? Does anyone else have any other questions? Tongue cleaner? So she's asking about tongue cleaners. So we forget to clean our tongues, right? You can use your own toothbrush. So yes, there's different types of tongue cleaners, but you don't really need a tongue cleaner. You can just use your brush to clean your tongue. However, there are tongue scrapers. You can now find those at Shoppers. I know. They usually have a little brush on it, and you can use that as well. Guys, it's really important we brush our tongue because that holds a lot of bacteria, which causes our breath to smell, right? So it's important that even though we're brushing our teeth, we brush our tongue. Okay? Any other questions?
ਜਿਹੜਾ ਵੀ ਕੁਐਸਚਨ ਕਰਦਾ ਚਲੋ ਪਲੀਜ਼ ਖੜਾ ਹੋ ਕੇ
Relative merits and demerits, dentures versus implants.
Dentures versus
Implants.
So implants are usually for maybe like 1 or 2 teeth in your mouth. So depending on your bone level in your mouth and how healthy your bone is, right? Maybe your dentist is gonna suggest to only remove one tooth, right? People think that it's easy to just remove all their teeth and get dentures placed, but it's so important to have your natural teeth because anything artificial in your mouth is not going to be the same as your actual teeth, right? Food will start to taste different. Dentures are not always the most comfortable, so they're not always comfortable. So when you get the suggestion to do implants, it would just be for 1 or 2 teeth, depending on your situation. If all your teeth are really bad, your dentist is going to be like, we can't save it, because what the implant is, they have to screw it into your bone. But if you don't have any bone, there's nothing to hold that screw, right? So it really depends on how healthy your bone is and if it can support an implant. Otherwise, they would say, no, sir, it's okay. We need to remove all your teeth and place a denture. But please take care of your teeth. We don't want to get to dentures, right? That's the last thing. It's not bad that you do have dentures, because sometimes there's other health conditions that can cause you to have dentures early, but we want to make sure, again, we take care of our teeth so we don't get there, okay? Any other questions? All good? Okay. Thank you so much for having us. I hope you really enjoyed that. I don't know if you guys want to add something.
Put it off. I wish कि आप इनका हौसला अफजाई करिएगा. Give them a good applause. मैं सच बताता हूं, यहां आके बोलना और एक नई जगह पे जाके बोलना और बुजुर्गों के साथ बोलना जिनके पास क्वेश्चंस का भंडार पड़ा हुआ है.
यहाँ पे बुजुर्ग कौन है?
मैं सच नहीं, कोई बुजुर्ग नहीं, सॉरी, मैं वापस लेता हूँ. बच्चों में आके बोलना, बच्चों में आके बोलना बुजुर्गों को बहुत मुश्किल होता है.